I'm Tiffany, and today I'm going to be doing a tube feeding and taking the NG tube out. So first I'm going to check my patient's chart and gather all of my supplies and use standard precautions. I'm now going to the patient's room. Knock, knock, knock. Good morning, Mrs. NG. My name is Tiffany. I'm going to be your student nurse today. Today I'm going to be administering your tube feeding and then removing your NG tube. This should take about 10 to 15 minutes. Do you have any questions? Alright, can you verify your name and date of birth for me? Alright, thank you. I'm going to raise my patient's bed up to working height. I'm also going to make sure the head of the bed is 30 to 45 degrees, or as normal as it would be when you're eating. Alright. I'm going to put on gloves. I'm going to measure first. I'm going to measure the tube from, let me slide right around too. I'm going to measure the tube from the tip of the nose down comparing it to previous documentation that it's the same length. I'm also going to then put gloves on, and I'm going to aspirate stomach contents, a little bit of stomach contents from the tube. I'm going to aspirate and check the pH and the color and the consistency of the contents. Once I've done multiple checks to ensure that the NG tube is in place, I can start the tube feeding. Well, I'm going to aspirate all of the stomach contents out of the stomach purposely policy. And then I'm also going to pour in 30 to 50 milliliters of water to irrigate the tube. Now I'm going to check my expiration date on my tube feeding, or my feeding, and then I'm going to administer the feeding. I'm going to let that drain. Never pushing it with the syringe pusher. Once that's drained, I'm going to then administer 30 to 60 milliliters of water and let that drain. When it's finished, I'm going to remove the syringe and clamp the tube. Now, I'm going to remove my gloves, perform hand hygiene. I'm going to now remove the NG tube. I would disconnect it from the suction machine. I would also disconnect the tape from the nose and the gown. I can get it off. I'm going to flush the tube with 10 mLs of water. When that's done, I'm gonna put gloves on. Alright, Mrs. NG, this is gonna be a little uncomfortable. I need you to take a deep breath and hold it. I'm going to remove the tube. I would put it on a towel. Then I would check the NG drainage in the tube. I am now going to remove my gloves, perform hand hygiene, put the side roll back up. I'm going to make sure the patient's in a comfortable position, lowering the bed all the way to the floor, checking the patient's room for safety. I'm gonna open the curtains, the door, if she wants. All right, Mrs. NG, do you have any questions today? All right, thank you for letting me give your tube feeding and take out your NG tube. I'm also gonna chart all of my findings in EHR.